So what matters most to me about using the feedback is that it drives change. So it supports and influences quality improvement initiatives, but it also shares what is working well and can be shared across the whole healthcare team. It's important that users of the system have a say in healthcare because we are part of the healthcare team. We can together make healthcare the best it can be for Fraser Health because we're seeing it from both sides, from clinical and non-clinical.
There's a lot to this, and every patient that I know really does take it quite personally. We have a very unique perspective because an awful lot of the people who take care of us aren't on our side of the transaction. They're well trained, they're very compassionate, they're very capable, but they don't know exactly what it's like from our point of view.
A lot of the valuable information is qualitative, right? I mean, our healthcare is not transactional. There's more to it. And I think capturing that, we just have to work on really capturing that essence properly. Right?
Hearing the perspective of other patients and seeing it through the survey, it's giving me more to think about than just my experience. And broadening that horizon with the work that I am doing with as being a patient partner, looking at these real-time surveys, it's putting more of a focus on the experience that, in a general sense, that people are having, so that the more voices we can hear, the more experiences that we can hear, the better it's going to be for me to be able to take a look at that data and really make some valuable decisions on the basis of it.
Some of the solutions are going to be costly, or they're requiring a lot of time for analysis and implementation. So I think what we need to do is not try to do large projects based on the feedback, but utilize the feedback to help support existing quality improvement projects or help in driving future initiatives or even looking at incremental changes. So how do we overcome the barriers of actually looking at all the feedback? So can we utilize technology like artificial intelligence or something else so that it simplifies the gathering of the data so that we can spend more time looking into the improvements we can make and looking at the opportunities for celebration?
It's very easy to collect a bunch of data and just have it sit somewhere. That's not going to do any favors to anybody, and if the goal is to improve overall service and improve the experience for both of us, for the caregivers as well as for the patient, then at the very least the observations, the suggestions, the feedback should be examined.
Sometimes people have challenges with change, and surveys can be challenging because we worry that maybe we're going to be criticized. But surprisingly, I've been involved, I know what the results from surveys are. They're opportunities for celebration because so many people appreciate the great care that they receive.
I believe there's a general willingness to make improvements to healthcare, no question there, because we hear all the time that there are all so many problems. And a lot of the people who are the healthcare providers, they are looking for ways to make improvement. But if there's somebody who is not open to changes and not open to suggestion, that's going to be the biggest barrier.
We'll take all this information, but we're only going to decide what we're going to do with, or we're only going to implement things that we think are important, or only looking at one side and not the other side.
I'm a patient partner at Eagle Ridge Hospital, and one of the things they do is on a monthly, quarterly basis, they bring together common themes or opportunities for improvement or opportunities to celebrate, and they share that. So they'll put it on the digital displays, they'll have it on posters, so it's available not only to the healthcare teams but as well as the public.
So in order for you to continue that cycle of collecting feedback and using the feedback, it's only important that you close the loop and talk with the person that provided you the feedback and say, this is what you helped do. So they are very aware of how valuable their feedback was.
So it's very important to share the results of the feedback, because the public wants to know that they're actually being heard and that's actually helping to improve healthcare, or it's celebrating what's working really well. So and it also will encourage them to actually fill out the survey, because they know they're being heard and they're actually part of making healthcare better.